Trauma affects individuals in diverse ways, and gender plays a significant role in shaping trauma response and recovery. This video explores the biological, psychological, and social factors that contribute to gender differences in trauma experiences. We will also discuss findings from recent studies on treatment effectiveness and how understanding these differences can enhance trauma therapy. Biological differences in trauma response. Hormonal influences. Hormones are critical in determining how men and women respond to stress and trauma. Cortisol, the primary stress hormone, is typically more elevated in women during stressful events. Additionally, women experience hormonal fluctuations related to menstrual cycles, pregnancy, and menopause, which can influence their trauma responses and recovery processes. For example, high estrogen levels can increase sensitivity to stress, while progesterone can have a calming effect. Brain structure and function. Research indicates that there are gender differences in brain structure and function that impact trauma response. The amygdala, which processes emotions and fear, tends to be more reactive in women, leading to heightened anxiety and fear responses. In contrast, men may have a more robust prefrontal cortex, which helps regulate emotions and stress responses. These differences can result in varying patterns of emotional and behavioral responses to trauma. Psychological differences in trauma response. Coping mechanisms. Men and women often utilize different coping mechanisms when dealing with trauma. Men may be more inclined to use avoidance and distraction techniques, such as immersing themselves in work or hobbies to cope with distress. Women, on the other hand, may engage in rumination, focusing on their emotions and seeking social support to process their experiences. These differing strategies can influence the severity and persistence of trauma symptoms. Expression of emotions. Societal norms and expectations regarding emotional expression can significantly impact how men and women respond to trauma. Women are generally more encouraged to express their emotions openly, which can facilitate emotional processing and healing. Men, however, may be socialized to suppress their emotions and present a stoic demeanor, leading to internalized stress and delayed recovery. This suppression can contribute to the development of secondary issues, such as substance abuse or depression. Social factors influencing trauma response. Support systems. Access to social support is a crucial factor in trauma recovery. Women often have more robust social networks and are more likely to seek support from friends, family, and mental health professionals. This support can provide emotional validation and practical assistance, aiding in the recovery process. Men, conversely, may be less likely to seek help and may have fewer support resources, impacting their recovery. The presence of supportive relationships can mitigate the impact of trauma and promote resilience. Gender-based violence. Women are disproportionately affected by certain types of trauma, such as sexual assault and domestic violence. The prevalence of gender-based violence shapes how women experience and respond to trauma and presents specific challenges in recovery. These experiences can lead to a heightened sense of vulnerability and mistrust, complicating the healing process. Addressing the unique needs of survivors of gender-based violence requires specialized interventions and support. Recent studies have provided valuable insights into how gender differences affect trauma response and recovery. Research published in Grad Coach highlights that women are more likely to develop post-traumatic stress disorder, PTSD, following traumatic events compared to men. However, women also tend to respond better to certain treatments, such as trauma-focused cognitive behavioral therapy, CBT and eye movement desensitization, and reprocessing, EMDR. Treatment effectiveness by gender. Hypnotherapy. Hypnotherapy has been shown to be extremely effective for both men and women. Trauma-focused CBT. Trauma-focused CBT is effective for both men and women. but studies suggest that women may experience greater reductions in PTSD symptoms compared to men. This may be due to women's greater willingness to engage in emotional processing and utilize social support during therapy. CBT helps individuals challenge and reframe negative thoughts, develop coping strategies, and reduce distress associated with traumatic memories. EMDR. EMDR is another effective treatment for PTSD that has been found to work well for both genders. Women may benefit more from EMDR due to their heightened emotional reactivity and ability to process emotions during the therapy sessions. EMDR involves guided eye movements or other bilateral stimulation while recalling traumatic memories, which helps reprocess these memories and reduce their emotional impact. Understanding gender differences in trauma response and recovery is crucial for providing effective and tailored treatment. By recognizing the unique experiences and challenges faced by men and women, mental health professionals can develop more personalized approaches to trauma therapy. Continued research in this area will help improve treatment outcomes and support individuals on their path to healing. Addressing these differences can enhance therapeutic interventions and promote more effective recovery for all trauma survivors.